Statins here for, come on in. Come in, come in.
Either way. Thanks.
Okay, great. Hey, Mamie, welcome. Good. Okay, you guys are right on time. Okay. So, thank you everybody for coming tonight to take a half hour out of your life to learn a little bit more about your body and your health and how your body works. For those of you who were here last week, we did a talk on the nervous system and how that controls all the functions in the body. We talked about how we live through the nervous system and how the nervous system is so important in our health. But the nervous system isn't the whole story. It's a big part of the story, but not the whole story. So what do you think would happen? Like if you took one vitamin or one mineral, I don't care what it is, and took it completely out of your body, what do you think would happen?
Probably go into shock.
Get out of balance, get sick.
Well, you'd probably be somewhere between the two, okay? Yeah, you wouldn't be well. Now, I will say this, is I saw somebody once with a vitamin D level of 8, you know, and the ideal should be 80 to 100, you know, and the lab values now are like 20 to 80, or 30 to 100. She had 8, and she was functioning. I don't think she was functioning extremely well, but 8's pretty low, okay? So I don't care what vitamin, what mineral you take out of your body. You take it out and bring it low enough, your body can't work, okay? I don't care how well your nervous system is working. Your body just can't work. So we're going to talk tonight about the other half of what causes biological breakdown in the body. Now, I went to undergraduate school. I majored in chemistry and went to chiropractic school, and so I took, physiology classes. I took biochemistry classes, and one of the things that I learned, that I noticed in these classes, especially later on, is that every single biological or biochemical reaction in the body did not require something. What do you think that was?
Water, oxygen.
Okay, they all require oxygen, okay? Or most of them do. Some of them are anaerobic. So oxygen wouldn't be oxygen. Water is definitely required, okay? But there's one thing, one class of things that I don't care what reaction you have in your body, what physiological reaction, what biochemical reaction, there's one thing in your body that I noticed none of those chemical reactions ever, not one time required, that a lot of people utilize. Food. They require food, okay? You can live for a while without food, Kathy, but...
Are you looking for like a mineral or like potassium or sodium?
Okay. They required, some of those chemicals required that. You got to have that.
You talking about element?
They didn't require pharmaceuticals.
Oh, okay.
Okay? Not one biochemical or physiological reaction that I saw in the body in any of my textbooks, and I think you could look them up now, ever required a pharmaceutical to work. Not one. So what does that tell you? Some people do need them, okay? But generally, our bodies don't need pharmaceuticals in order to work properly. Now, you can get so far beyond, you can get so sick and so depleted that you need them to, you might need some pharmaceuticals to stay alive until you can figure out what's wrong with you. But none of the biological reactions in our body require a pharmaceutical. They require, what do they require? What is our body, what are the chemical reactions in our body? What chemicals are required in our body
So like potassium,
that we find in our food? Okay, potassium's part of that, but I'm looking for something not quite that specific. Minerals, vitamins.
Yeah.
What else?
How about water?
Water,
Oxygen.
oxygen, but we're looking at, okay, besides water and oxygen, okay. Vitamins and minerals are 2,
Nutrients,
okay, from what?
protein,
Protein, yeah, good job. What else?
Antioxidants.
Okay, antioxidants are made from vitamins, okay. There's
carbohydrates,
carbohydrates, good job. What else?
Lipids.
Yeah, fats,
Fats.
okay. And I would add one more to that, phytonutrients, okay, which we get from, where do we get phytonutrients from?
Plants.
Plants.
Vegetables, yeah.
It's the part of the plant that gives it its texture and its color. So all the things in our body, all the reactions in our body require those things, okay? Now, out of those things, proteins, carbohydrates, fats, vitamins, and minerals, our body makes what it needs to function. So if it doesn't have those things, what happens?
it goes down.
Malfunctions.
It breaks down, right? It breaks down, okay? So let me give you an example. Let me ask you a question. What happens if your potassium, either your sodium or your potassium, gets too low? What happens? Anybody know?
Yeah, our neighbor was so low, he was in the hospital. Your
Couldn't move.
body can't.
Hey, your heart stops.
Yeah.
Yeah, you go into cardiac arrest, okay? So you got to have those things in order to work. That's the area that we call functional medicine, okay? And that's what we're going to talk about tonight, is functional medicine. We have all these diseases, okay, these named diseases, okay? But all these diseases have a root cause. And what medicine treats, what our healthcare system treats, is this. They pay very little attention to that right there. So this is what we're going to talk about tonight, all right? So, let's look at current health statistics. The U.S. spends more on health care than the next 10 highest countries combined. We have less than 5% of the world's population. We take 50% of all the world's drugs, 80% of all the world's painkillers. According to the World Health Organization, the U.S. spends a higher proportion of its gross domestic product on health, but ranks 37th among 191 countries in effectiveness of healthcare system. So what's wrong with that picture? There's a lot wrong with that picture, okay? The third leading cause of death in the United States is the effects of properly prescribed pharmaceuticals and hospital error. Okay, that's out of a medical journal. That's out of JMA. Okay, so I'm just going to ask you a question. What percentage, I was thinking about this today, what percentage, if you look at the entire U.S. population, or just go to a mall and watch people walk around, what percentage of those people do you think are healthy?
Maybe 30%.
Maybe 10.
20?
I think 30 is a little high.
I'm just kidding.
But that's okay, that's okay. I was thinking maybe 5%. That's my guess. Could be off a little bit. My guess is about 5%. Okay? So, our healthcare system does some things really, really well. It's just trauma care. It does reconstructive surgery well, diagnostic imaging. There's some things it does very well, and I'll give all the credit in the world to our healthcare system for that. This is what the New England Journal of Medicine said in 2012. It says, although the United States pays more for medical care than any other country, and this is a direct quote out of that article, problems abound in our healthcare system. Unsustainable costs, poor outcomes, frequent medical errors, poor patient satisfaction, worsening health disparities all point to a need for transformative change. Unfortunately, many modifiable risk factors for chronic disease are not being addressed adequately, i.e. the roots of what we looked at. A prevention model focused on forestalling the development of disease before symptoms or life-threatening events occur is the best solution to the current crisis. That was New England Journal of Medicine, one of the top 5 medical journals in the world, stated that. It seems like not a lot of people have paid much attention to this article, in my opinion, okay? So our current system does things very well. Like I said, if you have a heart attack or serious accident, it works great, okay? However, if you have fibromyalgia, type 2 diabetes, chronic fatigue, or arthritis, it doesn't do so well. So what is functional medicine? Functional medicine is a medical approach that focuses on identifying the actual causes of diseases rather than treating symptoms. So we want to find out what's the origin of that disease so we can give actual meaningful treatment. So let's give you an example. If you have let's say you have low potassium to where your heart is not beating properly, okay? What do you think you need? Do you need heart medicine or do you need potassium? Potassium, yeah, okay. There's a lot of medical conditions out there like that where people are getting drugs and they're not getting what they need in order to correct the problem. Like type 2 diabetes would be a classical example of that. So functional medicine practitioners ask two basic questions. Is there something in the body that should not be there? i.e., parasites, hidden bacterial or fungal infection, toxic chemicals, heavy metals, toxic fatty acids. Where do you get toxic fatty acids from, by the way?
McDonald's.
Who said McDonald's?
I did.
Yes, that's right. Yeah, that's a big part, right? Fast food places, right? It's our diet. Structural imbalances, medication side effects, food intolerance such as gluten, dairy, or soy, toxic emotions such as anger, greed, resentment, or unforgiveness. These are all things that should not be part of who we are. So, or is the body lacking something that it needs? For example, trace minerals, specific vitamins, phytonutrition, digestive enzymes, probiotics, exercise, diversity of gut flora, or maybe positive relationships. I had a patient one time, she came in for blood work, and I knew this woman somewhat, and her blood work was really good, yet she wasn't well. And after talking to her, I said, you know, your problem is you don't need much nutrition. You're lonely. You just need some companionship. That's basically what she needed. I can't make that happen. I can't assign her a soulmate. I mean, the government probably will figure that out someday, but I can't do that. But anyway, that's what I thought she needed. So, are the health issues we face in our civilization pharmaceutical deficiencies? I mean, we just don't have enough pharmaceuticals. 1 in 10 people in America take an antidepressant drug or some mind-altering pharmaceutical. Do all these people have Prozac deficiencies? Are they just born with, Zoloft or Prozac deficiencies or Effexor deficiencies? No. There's a reason that there's something going on in their body that's causing that or contributing to that. So, how would a functional medicine doctor like myself treat chronic depression? Well, again, we need to look at what's causing the brain or the body to do that, okay? So it could be trapped emotion. And last December, I did a talk on emotions and health. We talked about that. Can they still access that online? Mm-hmm. You can still watch that talk, by the way. Could be food intolerances, gut flora imbalances, heavy metals, lack of sleep, cardiac function, fatty acid imbalance, elevated A1C, or blood sugar. There's just an article, and I have it in my office, I could show it to you, that just came out in JMA last week. Copied it off. They were talking about the association between blood sugar imbalances in the body and Alzheimer's. Interesting, okay? They're saying none of the Alzheimer's drugs that people have been, that the pharmaceutical companies have been working on have worked. And this is what they were talking about in terms of what really is causing Alzheimer's. Now, there's other things besides this, but I thought food intolerance causes massive inflammation in your body. Let's say gluten intolerance. Where does that inflammation go?
Everywhere.
Yes, everywhere, including your brain, okay? And so you're right, it actually stimulates, gives the vagus nerve bad information which goes to your brain, which could cause depression and brain dysfunction. And we know that gluten intolerance can actually cause certain types of ataxia and palsies where people just shake, okay? We know that for a fact now. So, one of the most common drugs prescribed are statins, to lower cholesterol. 30 million Americans take them. Again, about one out of 10 people. But they just don't lower cholesterol. They prevent the biosynthesis of important biological compounds like vitamin D, coenzyme Q10, which you need for your cells to produce energy, sex hormones. Okay, I have a whole talk on cholesterol. I talk a lot about what they do to sex hormones. So typical side effects of statin drugs are muscle joint pain, memory loss, no energy, loss of sexual libido, low testosterone, diabetes, increase in overall death rate. Boy, isn't that a party? Okay? Like, who'd want to take this stuff? I wouldn't do it. Okay? There's a lot better ways to get cholesterol down. Okay? What's one way to drop your cholesterol?
Exercise.
Yeah, exercise. What a concept, okay? So where conventional doctors would normally prescribe pharmaceuticals like Prilosec, Prevacid, or Acifex to treat acid reflux or heartburn, what I would do is I would look for these things: low stomach acid, which I can figure that out in the office; deficient pancreatic enzymes, I can figure that out in the office; chronic food intolerances, H. pylori, leaky gut, gallbladder dysfunction, I can figure that out in the office; hiatal hernia, I can figure that out in the office; too much soda pop, just ask the patient, how much are you drinking, okay? So I would just get that out of your diet. If you're drinking any of that, just get it out. It's poison. So this is how I would look at digestive issues rather than giving them something to cover it up. So again, disease is like an iceberg. The symptoms are what's poking out of the water, but the causes are all what's beneath the water, which is about 80% of the iceberg. So Sir William Mossler, he's an interesting guy. He's one of the founders of Johns Hopkins Hospital, okay? Very famous physician. And he said he was actually more of a functional medicine thinker, I thought. He said, the good physician treats a disease, the great physician treats the patient who has a disease. It's more important to know what sort of patient has a disease and what sort of disease has the patient. Here's another one of his quotes. He says, if you listen carefully to the patient, they will tell you the diagnosis. That is so true. A good case history is about 80% of what you need to know. Very, very powerful. Now I'm going to give you 3 case studies of people that I've seen in my office, of functional medicine patients. This is a 40-year-old female who came in. She came in last September, so these are fairly recent. She had these symptoms: daily stomach pain, which was getting more frequent, alternating constipation and diarrhea. Her stomach pain was so bad, we caused her to just go to bed and just lay in bed for a lot of days. She had past gallbladder removal, which did absolutely nothing for this. So she originally went to her physician for this. They said, well, let's take the gallbladder out, and it didn't do anything for her. In fact, she didn't notice any change, okay? She had mild anxiety and depression. She'd been on Prilosec for 10 years, okay? So what's Prilosec do, by the way?
Stops your stomach acid.
Yeah. Yeah.
Breaking down food.
Right. So your stomach produces acid. Do you think that's normal for the stomach? Yeah, it's supposed to do that. Yeah, it's supposed to do that. So you're stopping something that your stomach is supposed to do. So here's what I found with her. I didn't even do any lab testing. I did all this in the office. I found a hiatal hernia, ileocecal valve dysfunction, low stomach acid, low pancreatic enzymes. So I gave her these things. manipulated her hiatal hernia, gave her bile salts, and I gave her stomach acid supplement, bitter herbs to stimulate digestion. It's a product I have called Digest Forte. And her stomach pain is much better. She still has some mild pain. You know, and the mild pain could be from all that Prilosec she's taken, you know. I mean, who knows? She has more energy, better focus. She doesn't need bed rest because of stomach pain anymore. And her bowel movements are much, much more normal than they used to be. And that was without any laboratory testing at all, just using my hands and using, you know, what I know. Here's another patient, 71-year-old female. Chronic fatigue, fibromyalgia, anxiety, depression, suicidal thoughts, poor digestion, constipation, poor memory. Okay? Do you think that she was happy? No, not a happy person. Okay? My findings. I did a lot of testing on this patient, by the way. I did quite a bit of laboratory work. Multiple food intolerances, low B vitamins, especially inositol. What's significant about that? Anybody know what inositol does? It's vitamin B9. Anybody know?
For blood sugar? No.
It might help blood sugar. It's mainly for brain connectivity, okay? Really good for making sure the connections in the brain work right. Poor conversion of T4 to T3, so her thyroid wasn't working. Fatty acid imbalances, major fatty acid imbalances. Very high AAEPA ratio. When this ratio is really high, really, really high, that's when you get suicidal thoughts. That's when you become violent, okay? If you looked at all these people that shoot up schools and churches, if you did an AAEPA ratio, I guarantee it'd be above 70 on every one of those patients. Every one of those people. She had low vitamin K, which says she wasn't digesting very well. Vitamin D insufficiency. So she had here's her past illnesses. She had her appendix out, thyroid cancer, failed lower back surgery. Okay, that's a biggie right there, and that's one that I can't fix. Okay, I've helped her with it, just using some low force work, but I cannot. That's a problem that I cannot fix. Bipolar, multiple auto accidents. She had some abusive family relationships. She was on these drugs. So what I did was corrected her nutritional deficiencies. She stopped eating the food she was intolerant to. Okay, I gave her Brazil nuts to increase selenium for her thyroid. Did very low force chiropractic to alleviate her lower back pain. Here's the results. Suicidal thoughts went away in about 3 to 4 weeks. Okay, depression got better. Back pain improved with chiropractic care. She was able to decrease her medication, but here's another one. I should have put it up there. Her digestion improved enormously. I mean, it got significantly better. I mean, like pretty much resolved. Okay, so did I correct everything on her? No, I didn't, but I really improved the quality of her life. There's some things I'm not going to fix. Okay, I'm just not. Like the failed lower back surgery. Here's one last one. This is a 13-year-old female that came into my office. She contracted mono 12 months before, and then the flu the following Christmas. So she had mono for a long time, and then she got the flu on top of that, okay? Mono's bad news, by the way. It's really bad because it's caused by the Epstein-Barr virus, which can hang out in your body for a long time after you think you're over it. What?
I've had mono.
Yeah. She developed the following symptoms. She had to drop out of the 7th grade. Daily migraines, persistent vomiting, chronic fatigue, constant abdominal pain, okay? My findings, autonomic nervous system imbalance, specific food intolerances, adrenal fatigue. Now, let me tell you a little bit about this patient. Her mother she'd gone through a really nasty divorce. She had no money. She could not afford any kind of laboratory testing. So everything I had to do, I did within the office setting. So autonomic nervous system imbalances basically says she needed chiropractic care. Okay, that's another way of saying it. So here's what I did. Low force chiropractic, I took her off foods and desensitized her to the foods that were causing her imbalances. Gave her specific nutritional formulas to heal her GI tract and her adrenal glands. So her migraines improved. I was not able to get rid of them, okay? But then again, I didn't see her as long as I would have liked to have. Her stomach pain and vomiting completely left. Energy came back. She was able to finish the 7th grade, and she's able to go on an overseas mission trip following summer. So those are 3 functional medicine cases. I could have put up more, but I thought that was pretty representative of what I do here. So here's the thing, is most of you probably know people who are suffering and taking pharmaceuticals and getting procedures done, and they're not getting any better. The fact of the matter is a lot of these people may have these problems, these deficiencies that I talked about before. And if those things are not identified, they're never going to get better. So I would say this, for the people that you know, and probably all of you are thinking of somebody right now, send them into the office. Let me do a consultation. Let me talk to them. Let's see if we can help these people. Sometimes, like this 13-year-old girl and that 40-year-old woman, we didn't even have to do lab work with. I was able to fix them everything here in the office without doing any laboratory work. Sometimes laboratory work's necessary. In fact, often it is, but not always. Oftentimes you can correct people, especially in some of these GI cases, without doing any kind of laboratory testing at all. And so I want to help these people, and you probably know people like that. So let Carmen know, and maybe we can really change some lives and turn some people's health around using functional medicine. Now, anybody, we got 2 more minutes before we go. Anybody have any questions?